the entire time that they did fundal massages, they would always say, okay, your uterus is midline and firm. So nobody ever said that I had a boggy uterus. And mind you, at this point, my uterus is lacerated. I have a perforated uterus, cervix, and vagina. And every time they would push on my uterus through, like, my belly button area, it caused severe pain. And I would scream and try to grab their arms away and stuff and say, stop, just stop. And they would say, well, we have to do this, we have to check. And even the OB, the oncoming OB, which was a different OB, came in and she was like, well, we'll just do it every hour then. We'll reduce it to every hour. And I'm like, it's worse than my labor. And my labor was an ROP baby, and that's if you've ever had it with PROM. So no bag of water and severe stacked contractions for 26 hours where the head was stuck in my pelvis. I still, to this day, 14 months later, have bone pain in my pelvis. So it was a severely painful labor. And I'm telling them this is worse than labor. And they didn't care, because they're used to women saying that hurts and just going with it anyway. Like they've had to desensitize themselves to listening to women, I guess, which is so sad. So I would just have to endure them shoving their arms on my lacerated uterus post-embolization, which also doesn't make a lot of sense. It's like, why are we pushing on something that just had a bunch of clogs put in it to stop the bleeding? And mind you, I bled a total, through this whole experience in the course of like 2 days, I bled 12 liters total, including the emergent hysterectomy, which I'm getting to in a minute. 12 liters total of blood loss. I received 22 bags of packed red cells, plus a lot of other blood products like FFP, cryo, such like that. I received 10 liters of LR in a 24-hour period. My lowest hemoglobin was 4. My lowest pH was 7.06 something. And my lowest blood pressure recorded was 40 systolic. So it's really crazy that I even survived. And the rapid response team that was there on day shift, because they were still there, they were rounding on me and looking at me and talking to me. And they were just, it was like they saw a ghost because they expected me to die. And the one nurse was like, do you remember me yelling in your ear telling you have to survive for your baby? And I was like, no. I'm like, I had a dream, but I can't remember it. So I don't know if I heard her voice or not, but obviously incredibly traumatic to go through something like that, and then to continuously be ignored in the ICU that my pain is still severe and then my stomach was getting bigger.